So now the next topic, as we discussed in the previous chapter, that was our basic concepts about a surveyor, what is surveying, what are the parts of surveyor, the tools of surveying, right? Now it is also important to learn about the lines which you are drawing along the surveyor, right? Along the cast, sorry, not the surveyor, right? So the lines which I told you, that which are been marked with the help of the carbon marker on the surfaces or on the highest point of the prominence of the teeth or the associated structures, it is called as a survey line. If I want to define it according to the glossary of prosthodontic terms, I would say a line drawn on a tooth or teeth of the cast by means of a surveyor for the purpose of determining the positions of various parts of the clasp or clasps. Okay, a single clasp or various clasp, right? It varies according to the clinical situation, right? So again I'll repeat what it is. It is a line drawn on a tooth or on various teeth of what? Of the cast, by the help of or by the means of surveyor. Why? For the purpose of determining the position of various parts of the class, because I told you in the last class that based on these lines only you decide your parts of your cast partial denture, right? So now we have survey lines. Now there was one person called as Blatterfin, right? Blatterfin was the first one who came up with this concept of survey lines. Blatterfin, not actually survey lines, he came with the concept of near zone and far zone, right? So what is near zone and far zone? Suppose I am drawing a clinical scenario, distal extension, right? The posterior teeth are missing. If I will divide this teeth from center into two halves, that is near zone and second is far zone, right? So when I divide the teeth into two equal halves on the left side and the right side, the area which is nearer to the edentulous space is called as near zone. NZ stands for near zone. The area which is away from the edentulous space is called as far zone. Now based on this near zone and far zone concept, we will classify the survey lines into four different categories. Okay, so the first one, if I talk about the first survey line, right? So the first survey line is your high survey line, second is the medium survey line, and third is the low survey line, fourth is the diagonal survey line. So starting with the first one, high survey line. So high survey line means, suppose this one, sorry, yeah, not this one, yeah, over here the high survey line. Okay, so now what does high survey line means? Not even this one, sorry, this one is the high survey line diagram. This is a diagram for your near zone and far zone which I have drawn over here. This is a diagram of survey line. This is how the survey line appears, right? From the front, from the mesial, from the distal aspect. This is the near zone and the far zone diagram, right? Now next over here is your high survey line. So when the line passes in the near zone, it is at occlusal third. In the far zone also it is at occlusal third. So the line is high. Now when will the line be high? Suppose I draw two clinical situations over here. This is one clinical situation. This is another clinical situation. Now if I take a surveyor and place it over here, so the line will come somewhere from here to here. Suppose if I take a surveyor and take it like this, okay, so probably if you see the high survey line, okay, it is commonly found in your inclined teeth on the one side of, if the teeth is inclined, right? So on one side the height of contour will be above, on the other side the height of contour will be below, right? So more common in inclined teeth. See, the higher the survey line, higher the survey line, more the undercut. Okay, more the undercut. Okay, so how much higher will be your survey line, that much undercut will be present. Okay, see this amount of undercut and see the undercut over here, right? So the undercut will be more in the cases of your high survey lines. Now when you have a more or a deep undercut, you need a type of clasp which can flex nicely and come out of that deep undercut, right? You need to place a clasp which can go smoothly into that deep undercut area when the patient is placing, and when he or she is removing the prosthesis, it should expand or flex nicely and come out of that area, correct? So now for that you need a material which is highly flexible. So you need a flexible clasp, and the example for it is wrought wire clasp. Okay, wrought wire clasp. See, usually we make the cast partial clasp of nickel chromium or cobalt chromium, right? They are more stiffer, they don't have that range of flexibility like what we have in our wrought wire clasp. Wrought wire clasp has more amount of flexibility. You can use that type of clasp to engage deep undercuts, right? Or sometimes not only in inclined teeth but also in the teeth which are more bulky on the occlusal third. Suppose the teeth which are bulkier on the occlusal third. So when the teeth is bulky in the occlusal third, obviously the line will be marked on the occlusal third area. This whole area becomes the undercut. Or if the teeth is inclined, so in two situations, either the teeth is inclined or a bulkier teeth, you will find these type of survey lines. Okay, and for high survey lines or a deep undercut, you will use what type of clasp? Wrought wire clasp. So this is how you do in surveying, right? You mark each and every height of contour, see, measure the height of contour, analyze it, think what part will be suitable for that design or for that condition, and then next move to the next part of the planning, right? So now the second type of survey line we have is a medium survey line. Okay, so medium survey line, if I say in the near zone, it will be in the occlusal third, but in the far zone it is going to be in the middle third. This is, you will see in normal cases, right? We should decide the tilt where majority of survey lines are medium. Okay, so medium survey lines is what? In the near zone it will be at the occlusal third. As it comes to the far zone, it moves to the middle third of the teeth, right? Majority of the teeth we should try that we get a medium survey line. Okay, the type of clasp preferable over here is a Akers clasp, A-K-E-R-S, Akers clasp, right? This clasp which we will understand when we move on to the topic of direct retainers. Okay, now the third survey line over here is your low survey line. Now for low survey line, again in the near zone it will be in the which area? In the cervical third of the teeth, cervical third. In the far zone it will be at the cervical third. Okay, so when both the parts of the survey line or the position of the survey line in the near zone as well as in the far zone is at the cervical third, you call it as a low survey line. So it will have least amount of undercut, right? The amount of undercut in these type of survey line is going to be very less. See, as I told you earlier, higher the survey line, more the undercut, lower the survey line, less the undercut, right? Now again, this type of survey line is also common in teeth with marked inclination. So for inclined teeth, yes, we saw in the previous diagram also. Suppose if this molar is inclined like this. Okay, so over here if I see, the survey line will be here. If I see over here, the survey line will be here, right? Or if you have a more fully inclined teeth, again the survey line goes down only. So in these kind of survey lines you use a T clasp or an I bar clasp. Okay, T clasp can be used or an I bar clasp can be used in the cases of low survey line, right? You cannot keep a normal clasp over here. Why? When you keep a normal clasp over here, it is nearer to your gingiva. There will be food lodgement and poor oral hygiene. Okay, correct? So for that you keep a T clasp which approaches. See, T clasp is different. I'll just show you a diagram so that you can relate what I'm trying to say. So if we talk about T clasp comes like this, goes and like this. Okay, whereas your normal clasp comes from here, right? So that is the difference between a T clasp and a normal C clasp, right? Or what you can do, other options, if you are not able to give T clasp also, so in that case again you can recontour the teeth, right? Enameloplasty, recontour the teeth and bring the survey line more upward. Okay, or you can tilt, right? You can change the tilt of the cast also, or you can create an undercut, right? So these are the options what you can do in a low survey line. Okay, now we have diagonal survey line. Diagonal is like on one side it will be at occlusal third, one side it will be at middle third, right? So it is more common in canines. If you see canines, it is more common in canines or premolars also, right? So canines and premolars are two teeth where you will see this diagonal kind of survey lines. Okay, and over here you can also go with T clasp again or an Acres clasp, right? Acres clasp can be given or a T clasp can be given, right? Understood? So this is high survey line, medium survey line, low survey line and the diagonal survey line. Now suppose you completed your surveying of the master cast. I mean surveying of your primary cast. You take a primary impression, you do the surveying of the primary or the diagnostic cast of the patient. Based on that surveying, you decide where all you want to modify the teeth or create an undercut. All that planning is there. Now once you have achieved that tilt that you decided, I'll give 5 degrees of tilt with this area, I'll modify with the grinding or doing enameloplasty, okay, correcting the surface of the teeth, and then I'll start with the fabrication of cast partial denture. But this is your diagnostic cast, correct? You will do all your planning on master cast. You never do or fabricate a prosthesis on diagnostic cast, right? So now if you want to transfer the same thing to your master cast, you cannot do surveying again because the whole thing is going to change after you alter the teeth, correct? So for that you have a process called as tripoding. Okay, so now what is tripoding? Tripoding is nothing but it is an orientation of the cast, or the orientation of the cast is recorded by a procedure called tripoding. So it is a process of recording the orientation or the tilt of the cast. Okay, tilt of the cast. So in short, once you do the surveying of your diagnostic cast, after that what you do is you do tripoding. Okay, so once you do the tripoding, what happens is the marks are there on your diagnostic cast. Now when you take your master cast, before placing the master cast on your cast holder, you orient your surveyor according, or you orient your surveyor according to these 3 marks. Okay, suppose I decided this, suppose this is a box. Okay, now I decide this is a cast, not a box. Okay, it is ideally a box but a cast. So now if I want this tilt, this is the tilt I have decided in my diagnostic cast. With my surveying arm, what I do, I mark 1 point over here, 1 point over here, 1 point over here, and remove this cast and keep aside. Okay, these points are marked on this cast. Now I take a master cast. Okay, suppose now I took a master cast. So now before I place this master cast on the cast holder, okay, what I do is I place again these cast on the cast holder, take my surveying arm and orient the surveying arm as well as the cast holder such that all the 3 points are contacting. So when all the 3 points are contacting, that means I have the same tilt what I had in the diagnostic cast, correct? Now while I'll keep the same tilt of the cast holder, remove the diagnostic cast and place the master cast. So the tilt which was there in the diagnostic cast will be transferred to the master cast. This is the whole concept of tripoding. So like this, what you do is you mark 1, 2 and 3 points. Okay, once you have marked these 3 points, now these 3 points will help you to orient the same tilt again, right? Because now you have some reference landmarks with which you can again bring the same tilt. If you don't have landmarks, you cannot decide because there are no markings on the cast holder that whether it is a 5 degree, 6 degree, 7 degree. It is arbitrary. Okay, so anything which is arbitrary needs some amount of logic or precision, right? So once you mark, then if you have another patient of cast partial, you cannot keep the same tilt. No, for every patient the tilt will vary. That is why these markings are useful. So for this patient, markings are there. When you have the master cast, you take the diagnostic cast, orient the cast holder and the tilt, and then place the master cast, so that your planning remains same, correct? Apart from that, you can also mark on the surfaces of the teeth also, right? You can mark on the surfaces of the teeth, soft tissues. You can use the burr shank. Our trimming burrs will be there now. You can use the burr shank, okay, because they will remain straight, right? So using that burr shank, you can again get the same tilt, or you can stick the burr shank to the cast also. So marking is the easiest and the simplest way. Then eventually, as the literature got added upon, there are various authors who gave various ideas apart from marking what we can do. See, you can mark on the surface of the teeth also like this, one anterior and two posterior, right? So that also can be done, okay. Lastly, when we talk about the tripoding part, okay, now you want to transfer this tripoding mark, which I have already explained you, right? So to transfer this tripoding mark, what you have to do is, firstly, this procedure is mainly to orient the master cast according to your diagnostic cast. I told you earlier only, right? So after tripoding these three reference point on your diagnostic cast, now there are some specific locations which you should be precise where you do the tripoding before transferring the tripoding, okay. So what areas you can use? You can use the distal marginal ridge of first molar, distal marginal ridges of first molars, right? So second, anteriorly you can use the incisal edge of lateral incisor, correct. Thirdly, you can also use over here, if you see, lingual cusp tip of the premolars. So the lingual cusp tip of premolars also can be used. Otherwise, you can use soft tissue landmarks like somewhere in the anterior, somewhere in the posterior also, okay. So this is how you mark and transfer the tripoding mark. So again, revising it, it's very simple. It's a bit complicated because you haven't done this. Once you do the same procedure, it is very easy, okay. You try to fetch a surveyor in your college from a postgraduate student, right? Go to that postgraduate student and ask him to just explain what is tripoding, okay. So they'll just explain you within 5 minutes. It's not a very big concept. Once you see that practically happening in front of you, it is very easy, okay. So survey lines are the lines which are drawn on the teeth or the tooth by what? By the surveyor. For what? For determining the position of the clasp. What are the different types of survey lines? We have high, medium, low, diagonal. These are based on what concept? Near zone and far zone concept given by Blatterfein, okay. Then next you have tripoding, where you mark 3 points either on the soft tissue or on the hard tissue, right? So in the diagnostic cast, right, when you do that in diagnostic cast, the same can be aligned in the master cast also. So in the master cast, before placing the master cast, you orient the cast holder according to those 3 markings which you had made. Then remove the diagnostic cast gently and place the master cast with the same tilt, right? So that is how you transfer the tripoding marks. So this was about survey lines and a basic gist of tripoding. So when you are asked to write a long answer on surveyor or surveying, first we explain what is a surveyor, introduction, different parts, different tools, then you come up to survey lines, then you come up to tripoding, right? Usually comes as a 10 marker question, sometimes can come as a short note of 5 marks also, right? So it is an important thing which should not be skipped. I hope you guys have understood, okay. If you guys have any doubt, you can reach out to me by any social media platforms and we can clear out whatever your difficulties are. So now, after we have discussed about surveyor, surveying, survey lines, tripoding, everything, now in the next chapter which we'll discuss in the coming lecture or in the coming class will be path of insertion, okay, because it is very important to understand surveying before moving on to path of insertion. Now it will be very easy for you to understand path of insertion, but yes, again This chapter is very important and a bit confusing if you just read it once and leave it, and if you are thinking of revising it 2 days before exam, no, you will go crazy, you will not understand. Okay, so keep in mind the small concepts and details of this topic. Thank you so much for your time. See you in the next class.